Hi, everyone. Welcome to the next installment of the health journey. So, last month we did his health. Today is all about her health and the things that you need to do to make sure that you stay up to date with your health journey, that you are in the best shape of your life, and that you know all that you need to know to have a prosperous life health wise. So, we have as our special guest once again the soon to be doctor, PhD, Charlynda Cartwright, who is a nurse and educator who will be sharing with us and presenting on her health. So, without further ado, I'm going to step to the side and we're going to jump right in.
Okay, so good night, everyone. Thank you for having me again. And this is a very important topic for all women. And I hope that we learn something tonight and take it into our lives, our daily lives, right? So let's begin. So, things we're going to talk about. Our agenda for tonight: common illnesses affecting women's health, preventative measures, and healthy lifestyles. So, just like last time when we talked about men's health, there are going to be some things that we talk about tonight where it may be overlapping because the same things that affect the men also affect women, and then it'll get a little bit more personalized where because we have a whole different reproductive organ, it'll be um, tailored to women. So let's begin. So we're going to talk about heart disease and stroke, diabetes and hypertension, maternal health issues and sexual health, urinary tract infections, and breast cancer, cervical cancer, and uterine cancer. Okay, so Okay, heart disease is the leading cause of death in women and men in the United States. About one in every five females' deaths are caused by heart disease, and this is coming from the CDC. Um, but just as last time, men tend to die more from this disease, but women are also affected. Risk factors for heart disease: hypertension, smoking, high cholesterol, a family history of cardiovascular disease, ethnic backgrounds of South Asia, Africa, and the Caribbean, and inactivity and exercise. So, this should be a review for those who came last time and paid attention. So there are four types of heart disease: coronary artery disease, arrhythmias, heart valve disease, and heart failure. Coronary artery diseases can be described as a heart attack, chest pain, discomfort back, in the upper back, chest pain, indigestion, burning, nausea, vomiting, extreme fatigue, upper body discomfort, dizziness, shortness of breath. And sometimes, well, specifically for women, you may feel like you have gas a lot. Um, that's one of the uh, signs that women would have. Normally, men will just have the what we call the hallmark signs, but women tend to feel it like indigestion. So that's specific to women: indigestion and heartburn, and nausea. Okay, and it's even worse if you have diabetes because diabetics also experience it that way. So if you're experiencing those things and it won't go away, there's nothing wrong with just going to get a checkup to rule out what's happening because a heart attack could be very serious, right? Detrimental, actually. So the next one is arrhythmias. Arrhythmias are fluttering feelings in the chest or palpitations, heart failure, shortness of breath, fatigue, or swelling of the feet, ankles, legs, abdomen, or neck veins. Okay, so those are some of the signs that we're going to look for in females for coronary artery disease. Next, we have stroke. Strokes are medical emergency and urgent treatment is essential. The sooner the person arrives for treatment of a stroke, the less damage happens. So, as I said last time, a stroke can be caused by any blockage. Could be a blood clot. It could be a fat embolism, um, and the blockage is in the arteries that causes the stroke. A stroke is essentially, well, as an ischemic stroke is when there's cessation of blood flow to part of the brain, right? So no blood goes there, the tissue gets ischemic or lack of oxygen, and then it starts to die. That's why you have this gray bluish color here on the slide because that's the lack of oxygen um, happening there. And that tends to cause some um, symptoms. And these are the symptoms that you would see in a female and in a male. Once the stroke is diagnosed, whether it is hemorrhagic or ischemic, the stroke will indicate um, these symptoms. You'll have the facial drooping, the arm drift or weakness, and you would have difficulty speaking. And lastly, T is for time to call emergency help, which would be our EMS systems, that's the ambulance, to get to the emergency room. Now, in the Bahamas, I know we feel that sometimes it's better to just go in the car and drive to the emergency room, but in this case, um, the ambulance would be a best choice to wait on the ambulance. Reason being, there are medications on the ambulance that would assist the patient in um, in their symptoms and to help relieve the will start the treatment for the stroke. And then the ambulance would do what they would do is call ahead to the hospital, let them know this is the patient that we have, these are the symptoms, so that they could prepare for the treatment and it can go smoothly. Okay, so calling the ambulance is a good um, it's a good thing to do with a stroke. Now, hemorrhagic stroke, as remember I mentioned that there are two types. The ischemic, where there's cessation of blood flow, and hemorrhagic, meaning that there is a bleed. So there's a bleeding in the brain, and that's causing the lack of oxygen. And that one has to be treated with surgery, okay? But an ischemic stroke can be treated with medication or surgery. And both our hospitals are equipped to handle the medication part. The surgical intervention, you would need a cath lab for a doctor's hospital has. Okay? All right, so let's look at some ways we can prevent the stroke and heart disease by eating a well balanced diet that includes fruits and vegetables. If you are a smoker, you should quit smoking. Smoking makes every single disease worse. Okay? Exercise regularly. Personally, I hate exercise. I rather eat a balanced diet and stay healthy, but I tend to do both to try and stay healthy. Reduce alcohol consumption, maintain a low cholesterol, reduce stress, take medications as prescribed, and get a regular checkup. So, a balanced diet. What does that mean? We want to have low levels of saturated fat, low levels of salt, low levels of sugar, fiber, and adequate fruits and vegetables, right? So, a balanced diet, you really want to make sure that those fatty foods or the cuts of meat, such as what um, like that we like the pork chop fat and the pork fat, all of those stuff, cream, cakes, biscuits, you want to try to decrease your intake of them because those fats are unhealthy fats. We have healthy fats such as, and everybody love avocado, right? Avocado pear, well, we call it pear in the Bahamas, right? Avocado with grits and sardines, one of my favorite meals. But olive oil, seeds, nuts, and the like. Those would be your healthy fats. You also want to monitor your consumption of fried foods, so you can't be going to bamboo all the time. Um, and conch and crawfish, all of those are high in cholesterol. You want to aim for low levels of salt, at least 1 teaspoon a day, and lower levels of sugar. Fiber and whole grain foods, fruits and vegetables, you need to have at least 5 portions of fruit and vegetables a day. And drink some water, right? We don't want to drink. I always say, I'm not going to drink my calories. I'm not drinking my calories because I love food so much. And so our whole grains that I mentioned, you can intake that by getting types of cereal that is whole grains. My friend told me this week that she just cut out the white rice and started doing the brown rice. And she said it's more filling and it actually helped her to reduce her blood pressure. So the whole grains are a better choice, and you can get them in the pasta. So when you don't want to do homemade spaghetti, get the whole grain pasta rather than the white one. Okay? All right, so let's move on. So that's diet. So now we're moving on to maternal health issues and sexual health. So this is when it gets personalized to us as females, right? Okay. So we have, I have several little boxes on here because it's a little, I wanted to touch on everything. So, about 80% of sexually active men and women, we're going to start with sexually transmitted infections. 80% of sexually active men and women will be infected with HPV at one point in time in their lives. So, HPV is human papilloma virus, and it is contracted through sexual intercourse. And we know we've been hearing about the other sexual transmitted infections our whole life. If you went to school, that's a part of um, we learn that in family life, learn it in biology. Then the nurse will come and talk to you. And I know because I've given the talk and started in grade 5 in the government schools, um, where we talk about these diseases such as chlamydia, gonorrhea, syphilis, and the like. But I wanted to mention chlamydia and gonorrhea specifically because they cause pelvic inflammatory disease, or PID. And the silent infection in the upper genital tract can cause permanent damage to your fallopian tubes, your uterus, and surrounding tissues, which can lead to infertility. And so these two infections you may not know that you have. And the only way to determine if you have it is to get your regular annual screening. So if you are sexually active, go get your screening. You have to advocate for yourself. I would like an STD panel screen and make sure that chlamydia and gonorrhea is a part of it. And of course, you do your HIV screening. Okay. So complications in pregnancy. So if you are pregnant, there are some things that can affect you and your baby, and that's iron deficiency, anemia, hypertension, and diabetes. All of these affect pregnant women. So if whether you are pregnant, whether you were diagnosed with hypertension and diabetes prior to becoming pregnant, or even if it came about during your pregnancy, because that can happen, you would want to continue to follow up with your doctor. They would more than likely put you on medications to control your hypertension and diabetes throughout the pregnancy, so that you and your baby are both healthy throughout the pregnancy. Preconception care. So thinking about getting pregnant, and you want to have a baby one day. Again, you want to control those chronic non-communicable diseases, and that would be again hypertension and diabetes, meaning that those are chronic diseases you don't get rid of, but they're not communicable, or like Bahamians say, catching. You can't catch that if you go around the person. right? So that's one of those diseases. Um, it's very common in our society, and in both men and women, and that can affect you conceiving. And of course, like we said, the sexually transmitted that also can affect your conception or fertility. Um, During pregnancy, what you would want to do is have your antenatal care. So we have, luckily in the Bahamas, and it's not that way everywhere in the world and in the Caribbean, as I've learned through my personal exposure. Antenatal care is not free for everyone, but we have it free here in the Bahamas. You can go to any public clinic and get blood screening for free. You can get, and they test you twice during your pregnancy. You can get vitamins. You'd be seen by the specialist, which would be an obstetrician, gynecologist. You'll be seen by midwives. Every visit, you would be able to get your ultrasounds. Now, the ultrasounds, um, well, during my own pregnancy, I found that as long as you had a government form, so this one little tip y'all could know, if you have a private physician. So I found out that if you had an ultrasound requisition from the government clinic, that the price for your ultrasound at Fort Terrace price is reduced significantly. So it's some sort of perk that the government worked out with them because of how the department in the hospital cannot handle those numbers to make sure that all pregnant women in the Bahamas gets their ultrasound, because otherwise it would be considered free in the hospital. But if you want to go to Fort Terrace, they have the price reduced significantly if it's on a government form. Just a little FYI, right? So that's maternal health issues and sexual health. So we're gonna move on. Um, and has anyone heard of Gardasil or the HPV vaccine? Even as a nurse, I remember I would always advocate for this vaccine, not just to my patients, but to my colleagues, because the last clinic that I worked in, there were a lot of young nurses. I think the oldest person might have been 30, maybe 32 at the time. So everybody was very young and vibrant. And so I encouraged us, let's get this vaccine, you know. It's been around for at least 15, 16 years, maybe more than that. Don't quote me. But it's been around for a while, and it was previously offered to privately. The government did not have it as a part of the vaccines that they offered free, but they do now. And as far as I remember, privately it was $300 to get one, and you need three to complete the series. And it's free at the clinic, so go ahead and take advantage of that. Let me tell you why you should, and I will tell you about it, and I would also like you to look it up for yourself, okay? So, this vaccine specifically, the Gardasil, this is the one that we carry in the government clinics. It's a quadrivalent human papilloma vaccine. It protects against infection with HPV types 6, 11, 16, and 18, which are responsible for 70 to 80% of cervical cancers and at least 90% of genital warts. There are more than 100 types of HPV strains, but there are 14 of them linked to cancer. But this vaccine has the protection against the popular ones that causes the cervical cancer and genital warts. The most high risks in the United States are types 16 and 18, which are both associated with precancers of the cervix. This vaccine is available again at all the government clinics in Nassau and the Family Islands, and we start giving it at age 12. So I would, yeah, around 12. You can, so your children, and not just the girls. So if there are any women listening who have sons, they would get this vaccine too. Okay? And that's because um, men carry HPV without knowing, and then they give it to other females. Okay? So you want to get your sons and your daughters vaccinated against it so that they stop the spread, and so that your daughters are protected from this virus. Okay? Um, I would like to say we're done with HPV, but it's going to come back when we talk about cancer. But we are moving on to urinary tract infections. I'm sure everybody know what a UTI is or have had one in the past. So let's talk a little bit about UTIs. Okay, so urinary tract infection is an infection in any part of your urinary system. Your kidneys, your urethra, bladder, or most most of the time right in your urethra. Okay, so I have a little picture here, not sure how well you can see it, but it shows you the kidneys, the ureters, your bladder, and your urethra. So your urethra is what you urinate out of, and this is the tract that leads up to the bladder. Then you have your ureters that leads to your kidneys, to both kidneys. Okay, the most infection involve the lower urinary tract infection. Urinary, the urinary tract, which would be your urethra and your bladder. So those two are the ones that are affected most of the time. Women are at greater risk for developing a UTI than men, um, because of because of your anatomy. So the urethra in a male is much longer, and the urethra, as you can see in this photo, is very short. And because of the anatomy of the vagina, we are at greater risk. They can be painful, annoying. However, they are serious because they can spread to your kidneys, or where you have a real problem. Okay, pyelonephritis. Um, so we ain't letting it go to the kidneys because we're gonna get checked out when we learn what these symptoms are, right? So let's look at some of the symptoms. So symptoms of the bladder can include and the UTI, urethra. You can have pain or burning when you're urinating, frequent urination, the feeling of the need to urinate despite an empty bladder, blood in your urine, pressure or cramping in the groin or lower abdomen. And then we have the symptoms of the kidney. The symptoms of the kidney is a little bit more. You will have fever, chills, pain in the lower back of your side, and nausea and vomiting. So this is when it starts to become a systemic problem, right? It's now affecting your system. So we want to get this sorted out. From you keep peeing, and sometimes you won't be able to hold your pee. You just went to the bathroom to urinate, and then you feel the urge that you want to urinate again. That's strange, right? When you go and you urinate and it's just a little bit, that's also not normal, and that is a sign of a urinary tract infection. Okay, so how can we prevent these UTIs? You can do it by doing the following: urinate after sexual activity. So remember when I said because of our anatomy, how the vagina, um, how the anatomy of the vagina causes us to be more at risk. So if you haven't, get a mirror and look so you could understand what I'm saying. So we have the urethra at the top, is right under the clitoral hood of the vagina. Then below that, you will have the opening of, or what we, or the opening of the vagina, right? And then after that, you have this little space or skin, and then the anus. So when we urinate, if we don't wipe from front to back, that you would be dragging some bacteria that's closest to the um, anus into the urethra. When you have sex, the head of the penis be knocking around there, and it could move bacteria from a place where it should be, to a place where it should not be. And one of the things that I don't have on this list, but are very common, are yeast infections. It could also happen that way as well. Okay. Um, we can take showers instead of baths. So sitting in a tub, and I do love to soak, but every time I do, I clean the tub right before I do it every single time because of how easily you can get a UTI from taking a bath. You want to avoid douching, sprays, or powders in the genital area, and teach the little girls to wipe properly from the front to the back. So you would start with the tissue at the vagina and take it to the anus rather than from the anus to the vagina. Okay, because that will cause the bacteria to enter the urethra and cause an infection there. Okay, so let's look at treatment. How do they treat UTIs? Antibiotics. They would give you antibiotics and ask you to drink lots of water. And if I remember, two cranberry juice helps. And they would give you pain medications because sometimes it can be very painful. But there's something that's special I should mention about antibiotics. And while this is applicable to UTIs, it's applicable whenever you take an antibiotic. So this is an important tip. Do not share your antibiotics with anyone, okay? Do not save your antibiotics for later. If the doctors, you see, as prescribed, if your bottle say take 2 tablets every 8 hours for 7 days, then you take 2 tablets every 8 hours for 7 days. Don't stop taking it because you feel better, okay? You do not want to do that. What it causes is your resistance to the antibiotics, and then when you really need them, they don't work. Okay, so take it as prescribed, and then don't go to the African pharmacy and get the little black and red ones because the doctor didn't prescribe them. Okay, frequently taking those antibiotics whenever you feel like you have a cold, and I do that because the cold is a virus and antibiotics don't treat viruses. So please seek medical attention when you are feeling ill. I strayed a little bit because that's a pet peeve of mine. And I know my people like to go and just take antibiotics whenever they feel like it. But it's causing more harm than good. Okay? And FYI, did you know that antibiotics can cause yeast infections? And if you're on birth control and you're on an antibiotic, it can cause your birth control to be ineffective and you can get pregnant. That's another reason not to just take them willy nilly, just so you know. Okay, so let's move on. We're moving on to breast cancer, cervical cancer, and uterine cancer. Almost at the end. Okay, so what is cancer? Cancer is a disease in which cells grow uncontrollably and spread to other parts of the body. Cancer can start almost anywhere in the body, which is made up of trillions of cells. So if you remember all the way back to health science and biology in high school and junior high school, our body is made up of cells. The cells um, come together, they make up tissues, which make up organs. Y'all remember that? Okay, good. So cells have a time period where they grow and then they die. In cancer, something is wrong with the DNA of the cell, and so it multiplies and then it don't die. It just keeps growing. So that's essentially what cancer is. And it can happen anywhere. So we're going to talk specifically about cervical cancer. Okay, sorry. We're going to talk about breast cancer first. My apologies. So, breast cancer is the second most common cancer in America, in American women. 12% of American women have a change of developing breast cancer in their lifetime. The average age of diagnosis in the Bahamas is 42, and in the United States, it's 62. So we have a greater prevalence here. 44% of Bahamian women with breast cancer had stage 3 or 4 of this disease. So that means that Bahamian wives, mothers, daughters, sisters, and friends are finding out about their cancer later and dying younger. So what can we do to affect change in specifically with breast cancer? Um, Stage 3 and stage 4 is really late to just be finding out. So there are some things that you can do to help um, reduce that. Your breast cancer screenings. You want to be doing, and this is every female, you want to be doing your monthly self examinations, and it can help you identify any changes in your breast to share with your primary provider. So that'll be your OBGYN. This is in addition to following your yearly annual mammogram, which should start at age 40. So if you're 40 and older, you should be getting a mammogram. Also, if you have a history of breast cancer that's strong in your family, then you would start doing ultrasounds earlier than 40, probably around 30. You would do a breast ultrasound so that they can screen for that, okay? So how do we do our breast self-examination? I have a picture, right? Well, several pictures right on here. So you want to stand in the mirror, just as how she has her hands on her waist, and you would put your shoulders forward. And what you would be looking for is for any dimpling in the breast. Next, you would want to put your hand behind your head as depicted in the photo, and you would do a circular motion as here depicted in this picture, and you would be feeling for any lumps that you see in the breast. Okay? Then you would lay down and do the same to both sides. When you get to the center of the breast, so you're going to start outward and work your way in. Once you get to the center and to the nipple, you would squeeze the nipple. You should not see any discharge coming from your nipple unless you are pregnant or breastfeeding. Discharge should not come from your nipple. So if that happens, um, you should seek medical attention. Additionally, some things that you can look for, the breast would have like a orange or grapefruit skin appearance. So that's the type of dimpling you would look. Any lumps that you feel, any abnormalities, and the only way you're gonna know that it's abnormal is if you do it every month. Okay, so if you do it every month, you should know what lump is there, what shouldn't be there, anything new, and that's how we would get that screening done very early on so that you're not diagnosed at third, 3 and 4 stage when it's kind of late. You want to try and catch that as soon as possible. One thing I forgot to mention, you would also um, palpate under the armpit because breast tissue is underneath your arm. Okay, so that's another place while you're doing your breast examination, you would also feel there as well. Okay, all right, so we're moving on to uterine cancer. So, what is uterine cancer? Uterine cancer is cancer of the uterus, which consists of endometrial cancer and uterine sarcoma. Uterine cancer is a general term to describe cancers of the uterus, the womb. Endometrial cancer develops in the endometrium, which is the lining of your uterus. It's one of the most common gynecological affecting your reproductive system. Uterine sarcoma develops in the myometrium, which is the muscle of the wall of your uterus. Uterine sarcomas are actually very rare, but it's a type of uterine cancer, so I mentioned it, okay? So let's look at some symptoms of this condition. Symptoms of uterine cancer or uterine sarcoma sorry, I'm going too far. Include vaginal bleeding between your periods. Oh, I'm not sure why that's moving. Anyway, read quickly. Vaginal bleeding between periods before menopause, or bleeding before menopause. Vaginal bleeding spotting postmenopausal, so you are already um, postmenopausal and you have stopped having your periods, and then you start to see a slight amount of vaginal bleeding. That is not normal. You should seek medical attention. Lower abdominal pain or cramping in your pelvis just below your belly. Thin, white, clear vaginal discharge if you're postmenopausal is also not normal. Extremely prolonged periods, frequent vaginal bleedings if you're older than 40 is also not normal. So you want to seek help or medical attention for that. Signs of uterine cancer can resemble those many conditions, especially true of other conditions affecting the reproductive organs. If you notice unusual pain, leaking, or bleeding, talk to your healthcare provider. An accurate diagnosis is important so that you get proper treatment. Okay? All right. Okay, so now we can move to our uterine cancer treatment. So it is treated with chemotherapy, which is a powerful drug to destroy cancer cells. Also, it can be treated with radiation therapy. Radiation sends targeted radiation beams to destroy the cancer cells. Hormone treatment gives hormones or blocks them to treat cancer, and immunotherapy helps your immune system to fight the cancer. Researchers are continuing to study more ways to treat cancer, but as we all know, there's not a cure as yet. Um, but it's important for you to know that most people with endometrial cancer will need surgery, and your particular treatment plan depends on the type of surgery, depends on the type of cancer that you have and your overall health. Other treatments would be the chemo, the radiation, and the hormone therapy. All right. So how can we reduce your risk of uterine cancer? Look what's back. Controlling diabetes, maintaining a healthy weight, and talk to your provider about using oral contraceptives because these medications can offer some protection against uterine cancer. So that's 1 point for birth control. Yay! Right? Okay. So we're moving on to cervical cancer. What is cervical cancer? Cervical cancer is the third most common type of cancer in women. It is much less common in the United States because of the routine use of pap smears. Another thing we all hate? Well, it's a life saving procedure, diagnostic test that actually has it less frequent in the United States. So we should do ours annually. Okay? All women are at risk for cervical cancer. It occurs most often in women over age 30. Long lasting infections with certain types of HPV is the main cause of cervical cancer. HPV is a virus that is passed from one person to another person during sex. At least half of sexual active women or people, sorry, will have HPV at some point in their lives, but few women will get cervical cancer. Okay? So, what are some symptoms of cervical cancer? Signs and symptoms of more advanced cervical cancer include bleeding after intercourse, bleeding between your periods or after menopause, watery, bloody vaginal discharge that may be heavy and have a foul odor, pelvic pain or pain during intercourse, and early stage cervical cancer generally produce no signs and symptoms. So that's why it's important for you to go ahead and do your pap smear annually because the pap smear is a A cytology test, so meaning it looks at the cells of the cervix under a microscope to determine if there are any changes in the cells. So you would know very early on. You don't have to wait until something is seriously wrong to figure out what's going on. Okay. Um, so we'll move on. Some of the risk factors for cervical cancer. Almost all cervical cancers are caused by HPV. HPV is a common virus that spreads through skin to skin contact, but also by sexual intercourse. There are many strains HPV. Some strains lead to cervical cancers and others lead to genital warts. And others don't cause any problems at all. But what we can do to prevent or decrease our risk of getting cervical cancer um, is to have our pap smear as soon as we are sexually active. But some of the risk factors include having sex at an early age, having multiple sex partners, or having a partner who has many sexual partners. So high risk sexual activities is what causes it. It's like I mentioned earlier, the men carry it around to women. So if you are dating or you're with having sex with someone who has unprotected sex with a lot of females and then they come and have sex with you, they can possibly be sharing that HPV to everyone, which can cause cancer. Okay? So yes, there's something else to worry about besides STDs can cause cancer. But the HPV vaccine, like I said, is really good at helping to prevent that. So let's look at the treatment. It's similar to the treatment for the uterine cancer. You still have your chemotherapy, radiation therapy, hormone, and immunotherapy. But the surgery, you can have surgery to remove the cervix, or and uterus, and surgery to cut away the cancer alone, or surgery just to remove the cervix. Okay, and that is the end of the show. Do you have any questions for me?
Thank you for that presentation. If anyone is wondering why I'm not on camera, it's because I am not feeling well of all days. So I did have a couple questions. You mentioned pain during sex,
Okay.
and I wanted to stay there because, I think we mentioned in the group that sex should not be painful.
No.
And there are other things that could be going on, like, vaginitis and stuff like that. So, like warning signs for people where maybe there's something you should get checked out, um, in terms of what I'm experiencing during my sex experience.
Yes. Sex should not be painful, but if you are having pain when you have sex, just as Emmy said, it does not have to be cancer. It can be vaginismus, meaning that your vagina is overactive, or it has spasms, which can cause pain with intercourse. Okay. There are several reasons as to why it could happen, but the only person that can help you is going to see a physician. Um, yeah, but painful sex is not normal.
Great. So, ladies, go and get checked out if you're experiencing that. Another one here is, why should we control diabetes if we want to prevent endometrial cancer?
Okay, thank you for that question. I'm not exactly sure why we should control diabetes, Dr. Watson, but I'm sure that you can tell me. I'll await on your response, Kalisha.
And then there are, I think, with cancer, weight loss seems to be a trend, in terms of like maybe late stage diagnosis.
Yeah.
I know, there are cancers like pancreatic cancer that are more like silent ones. So I guess, what are the big three things that people know automatically something is very wrong here. I need to go and see a doctor ASAP. This is probably life or death.
Pain.
Pain.
Pain, I would say that pain is your body's number one sign that something is wrong. If you have an unexplained pain and you don't know why, and it won't go away, that is definitely not normal. And you should go and get it checked out. And the only way to determine what is going on with you is if you are having regular screenings. So that annual physical that we talked about, that would help most of help you to or your physician to figure out what's going on with you, but do not deny the pain.
Perfect. And then when we are working to find our doctor, what should we be looking for? Because for some people, that has been, I guess, the biggest struggle. Is
Yes.
there like a particular type of qualification? Should they be OBGYN certified? Should we just go to a family doctor? Like how should we navigate that choice?
Well, I think that finding an OBGYN would make the most sense because at the end of the day you have uh, a female reproductive organ, and you would want to have the specialist when it comes to going into all of the all of those topics that we mentioned today. Besides that, the OBGYN can look at the other symptoms that you're having. If you go to a regular doctor, it's not that they can't do the pap smears and the like, especially the family medicine practitioners can do that. But I would suggest the OBGYN. That way you don't have to switch if and when you get pregnant.
That makes a ton of sense. I don't have any more questions. I don't know if the audience has any questions. But this was great information. I took some mental notes. I'm going to watch the replay as I always do and, get more information from it. I've seen, women pass away and I think we tend to
Mhm.
ignore the symptoms and it's so frustrating, like I've heard of women who saw the lump in their breast, but they wanted to get through Christmas and it was so busy so they wasted 3 weeks, and then it's another 3 weeks to get an appointment. And by the time you get the appointment, like,
Absolutely.
it's that all of that time mattered.
Yeah.
People who saw blood in their stools and they was like, well, let me just wait it out, and then these are life and these could lead to, spiraling decisions or very expensive procedures. Um, and so definitely I think I would say and leave with everyone is don't wait, no matter what you see, go and check it out. And I know sometimes when I work out, I'm like, all of a sudden, I have these random pains, and it almost discourages me from working out because I'm like, I don't know what is a pain from a pain, And so I constantly watch my body. Our breasts change during, menstruation. Mine get a little bit, more thick under my armpits and stuff like that. And so only you know your body, only you know your breasts. And so you have to be your advocate to make sure that you are checking up, you have your baseline screenings, you have something for a doctor to compare to, and then you yourself, you're doing things and comparing it. So
And please
we just want you to
advocate,
stay alive.
advocate for yourself, because you have sometimes that people won't, healthcare professionals won't listen, or they would think it's something else. But there's nothing wrong with a second opinion, especially if it's persistent. You know that something is wrong. Deep down inside, you know, right? Blood in the stool, like you said, is not normal. I lost a friend in 2020 to breast cancer. And I still can't believe she's not here because she was my age. So it can, don't think that it can't happen to you. But doing those, she found out by doing a breast examination. She found the lump under her arm, in her armpit, right? Um, and I urged her to seek medical attention, and she wanted to try the natural remedy. And sorry to say that did not work. But you can't force anyone to do anything. You can only advise, and that was her personal decision. But that was very disheartening. Please seek care.
Yeah, that is. I mean, I think that's a whole other topic about when you should and should not, and how much wisdom you should use. But like you said, you can't force anyone.
Oh,
Your journey is your journey. God told you what God told you. Make sure you're hearing correctly. Make sure that, you're not being stubborn and hard hearted and hard headed
yes.
in your health choices because, it's so much more beyond you. My mom died of asthma and she decided to delay calling someone for help because she was a nurse and didn't want to wake anyone up.
Oh boy.
And sometimes, like, we need to be an inconvenience.
Yes.
And don't be afraid to be an inconvenience when it comes to your health because people need you here. They rely on you, they depend on you, they love you.
Hmm.
And so when it comes to your health, don't be afraid to be an inconvenience. Don't be afraid to be a nag. Get your second opinion. Don't stop until you understand what's going on. You be the best advocate for yourself. So we want to thank you, special thank you for the presentation tonight. I really appreciate you coming on board 2 months back to back. Like almost, I guess, just 2 weeks ago, you were on with us.
Yes.
I feel like you're on the team now. But I really appreciate you, pouring so much time into us as a community. And, I know that some lives are going to be saved because of it. Maybe not tomorrow, but in 10 years, 20 years, people are going to remember the nuggets they got from you. And it will definitely save a life. So thank you so much.
Thank you too.
God bless. Have a good night, everyone.
Bye bye.
Bye.